The PCAs are your first eyes and ears. They are the ones who usually see the patients first in the morning, do their vitals, say hello. If something's going on, 90% of the time it's brought from the PCA.
It feels like we're like that first line of every patient's interaction.
PCA are the second set of eyes for the RN. So the PCA, although not trained to assess, would notice an acute change in the patient, would be another ear for the patient to report any symptoms. They're able to relieve the RN of some of the tasks that we're able to delegate them.
I do vitals, ADLs, I draw blood, EKGs.
Helping them brush their teeth, brush their hair. Bed baths is something we do.
Get them up to the chair, walk them to the bathroom.
If we have to use a bedpan, and for some people, that comes with cleaning them up.
Help feed them, help cut their food up.
If they can and they're able to, we love to be able to help patients like take a shower if they can.
Assessing skin with the nurse, checking things like that, helping with wound changes, a lot of that stuff the nurses couldn't do on their own.
Patients often need help like putting their hearing aids in, putting dentures in, making sure those are clean. If they have a prosthetic, like taking care of that. They might need help with care for their Foleys or different ostomy bags or stuff like that. Transportation to and from everywhere. So if they walk, wheelchair, crutches, a sit to stand lift, just getting them to and from the beds, they're not just laying in bed all day.
We work as a team, so it just gets the job done a lot easier, more smoothly, effectively, and the patient gets a sense of presence when they're seeing either me or the PCA.
They get to know the patients really well because, again, they go in there at certain specific times. They're changing their beds, they're helping them shower, they're doing a lot of the tasks. So they get to know the patient really well. They set up a really nice rapport with the patients.
I'm sometimes literally the first person that people see in the morning when they wake up, when they first get to the hospital. So to be able to have that like one-on-one medical things aside, how are you doing? We're gonna take care of you. How do you walk? What do you like to eat? Are there things we can do for you that make this feel, more comfortable, more like home? Because their routine coming from home and whatever they do at home is completely taken away when they're in the hospital.
There's a lot of opportunity to grow within Kaleida, especially starting from a PCA level. You see so many things on this floor, on all the floors as a PCA. Even if they're not looking to advance into nursing, they're so knowledgeable about healthcare things because of the way that they're involved with the nurse and the patient and learning all of those things. It's super cool. We wouldn't be able to do our jobs efficiently without the help of the PCAs. They are an integral part to our team when taking care of the patients and getting them better.